Welcome to Sense and Sustainability, your podcast channel for sustainable procurement. We hope you like what you hear. Please go to www.iso2400.org for more information, learning resources, tools, and much more.
Welcome to Sense and Sustainability, our podcast series for all things sustainable procurement. I'm Sean McCarthy. I'm a director of Action Sustainability Community Interest Company that runs this programme, and also our website, iso2400.org, which aims to build a community of practice in sustainable procurement around the world. I'm delighted to introduce Neil and Gillian today from the UK, who will be talking to us about procurement in the public sector and in the healthcare sector, and how we can actually deliver sustainability, circular economy, social value, etc. throughout our procurement programs. So without further ado, Neil, would you like to introduce yourself, tell us a bit about your background and how you became involved in the sustainability agenda?
I can. Thank you, Sean, for the invite. So I probably first got involved, for those with very long memories, with some work when I was working more in local government, with something called the Flexible Framework, which I know Action Sustainability were heavily involved in. That was probably 15, 20 years ago, I guess, when this agenda was first emerging. So that was when that was where I first got involved in this, trying to work more with local authorities in the UK. But since then, been more involved in the NHS and the healthcare, with roles at both the Department of Health and NHS England, and now working with a fairly new entity in the NHS in the UK called Integrated Care Systems. And that's when all the NHS organisations in the regions are coming and working as one. So working across the moment, both the Cheshire and Merseyside ICS and the Greater Manchester ICS, and helping the NHS organisations in those areas to start to look at their carbon footprints, what they're doing around social value, starting to really take seriously, their role as an anchor institute, in the regions they're working. So I think it's a really exciting time.
Brilliant. Thanks, Neil. Jill, would you like to say a few words about yourself and how you became embroiled in this agenda?
I will, thank you. So, and also thank you, Sean, for inviting me to join. I've been in procurement for almost 30 years, spanning both private sector and public sector. And I fell into procurement like many people 30 years ago, sort of fell into it rather than choosing it as a career. But I think very early on in my career in procurement, I was acutely aware about the broader impacts that procurement could have. It's almost a unique role in lots of ways, in that you have the ability to touch lots of different parts of an organisation and lots of different impacts from procurement. And I think I've been trying to take cost off the table, or at least deprioritise cost, for practically my whole career, at least the last 20 years. And I joined the public sector in 2013, so 10 years ago, over 10 years ago now. And the Public Services Act had just been assented to law then. And I also was using the flexible framework. So I went into higher education. That was where I started out in public sector. And students there were calling for a greener, cleaner university. The expectation from a 26,000 strong student body was really about, actually, we want more. So we want you to spend our money wisely, but we're interested in our footprint on the planet, and we're interested in the social impact of the money that we invest in our student career in the university. And that really gave me that first ability to take something that I had always been passionate about and really start to think about what the social and environmental impacts that procurement can have. And I've been working in that guise ever since, really.
Thank you. So I guess between us, we've probably got about a century of procurement experience, which is a bit scary. Yeah, I remember the flexible framework well. I was part of the Sustainable Procurement Task Force that created it, and I must admit it was kind of. I didn't develop the entire flexible framework, but the idea of it was my suggestion in the first place, and I kind of regretted that, because it was intended to be a sort of maturity matrix in order to establish the organisation arrangements to deliver sustainable procurement. But what tended to happen was people would like tick each box and say, I've done all those things, but then never actually do any sustainable procurement, just like I've done the training and I've done the processing, I've done all those things. Therefore, I've done sustainable procurement. And that's where BS 8903 came out from the flexible framework, and then eventually the ISO standard, ISO 2400. But if you look at the flexible framework and you look at the enablers, section 6 in the ISO 2400 standard, they're actually very similar. It hasn't changed that much, but we've added the sort of strategic element to it, and also the practice that says this is how you actually do it, which is kind of quite important. So, okay, so either or both of you, can you talk a little bit more about what you're doing now and what the challenges are around sustainability? And Neil, I was particularly interested in the expression you used. Was it anchor institution? What does that mean, and how might that make a difference?
Yeah, I mean, some may see the term anchor institution as a fairly new idea. I'm not sure it is. I think it's been around for a long time, and as often happens, things get renamed and reinvented. What we're really looking at is, how the NHS operates and looks at the environment around where it is situated. So it's actually wider than just social value, but it's looking at, I guess, the wider sort of impact of an NHS or a public sector organisation operating. So really, an anchor institution is just anyone who is embedded in the region where they're operating. And it gets an organisation to look at, what is its impact on the environment? What is its carbon emissions, and what impacting are they having, on the residents around where they're operating? Having a look at their estates, is there a better use of their estate? Can we, let other organisations actually use some of our buildings when we're not using them in the NHS? Also looking at workforce, are we getting people into jobs? And some of the figures are quite surprising. You might find quite low areas of unemployment, where there is a big hospital. So how can we help people who live around hospitals and NHS estates get work in the NHS? Lots of work going on in that space. And I guess where we're sort of also interested here is on the social value side. How can we use our public sector, our NHS expenditure in a better way to support both either third sector organisations that can supply some of the goods and services, or even, small businesses? How can we support them and give them working contracts? And some of this is quite obvious. If you're getting people into better jobs, they're earning more money, they'll be eating better, their mental health will be better. Over the short, medium, and especially the longer term, there is a benefit here to the NHS and healthcare system, because, there'll be less need for the NHS if people are in work, they're happier, they're healthier. So, there's a big focus now on this, and the new integrated care systems, which you talked about earlier, the fourth purpose of these integrated care systems is to look at their economic impact. How can they improve the economic impact? And you're starting now to see lots more work on this. And I know you also, especially in Jill's area, she's looking at, how do we get some of these organisations, more up to speed so they are able to bid for this work and be very successful, which I think is really exciting. And we're sort of under pressure, I think, in the NHS, very rightly, to try to increase our spend, in the areas where we operate, and in the UK in general. Lots of the NHS spend at the moment goes sort of outside of the UK, which is something we can look at.
So, Jill, Neil's given you a nice little segue. How do you do this then? Just a small challenge.
Yeah, no, the $6 million question, right?
$60 million or $600 million question.
Yeah, $290 billion question in the public sector. And the answer is it's not easy. So having been a procurer for my whole career, letting procurements into the market, I've also for the past 10 years been a small or micro business supplying the public sector. And so some of the experiences that Neil described in terms of it being disproportionately difficult for smaller organisations or voluntary sector organisations or startups to compete against their larger counterparts it's real and it's rife. And 99.3%, I think, or something of that magnitude of businesses in the UK are classified as a small to medium enterprise. And actually, a big proportion of those are 0 to 49 employees. So we're talking about two big volume markets, a market of providers that is a volume of spend and of quantity in the public sector. But the gap between the two is really tough. Now, the intent and aspiration, as Neil has just described, is alive and well. The public sector really wants to access the whole marketplace. And so what I do today is lead an organisation that effectively tries to sit in the middle to understand what the barriers to entry and growth are for organisations in the public sector and to do something about it, and to build that intelligence database to help buyers like Neil to be able to understand what representation looks like locally, but understand actually what procurements need to have in them to be inclusive and accessible. And, you know, we're only scratching the surface, right? So we're supporting 8,500 businesses at the minute, which feels like a lot, but not when you compare it to the 5.5 million SMEs that there are in the UK. We're all just scratching the surface a little bit. But what we've got to do and what we're focusing on is turning rhetoric into action. It's about doing something, and all of the small steps that the NHS is taking, that buyers like Neil are taking, that suppliers that we're supporting are taking, will all constitute a change over time, which is good.
So how do you, I mean, loads of issues we can go for here. What about the multiple tiers of the supply chain? So is your objective to, getting small businesses into tier one of a very large organisation the size of the NHS? And I did hear an anecdote once, it was a while ago, that the NHS is the second biggest employer in the world after the Indian Civil Service. I don't know whether that's true or not, but the size and shape of the organisation is absolutely huge. So is it about getting smaller businesses into tier one, or is it about encouraging your tier ones to engage with smaller businesses, or is it a bit of both?
I can take my opinion, Neil, if you want on that, and then you can come after. I think it's both. The supply chain isn't a dirty word. I think from my perspective, what we want is the business to be able to choose what the right route is for them, and for the buyer to be able to select on that basis. So it might be that being tier 2 or tier 3 is absolutely the most appropriate place for an organisation to be versus tier 1. If you're in the supply chain, there is pressure, I think, to be able to be honourable and have integrity with that social and environmental and economic impact locally through your supply chain. Neil and I have talked a lot. Those big ticket social items like homelessness, worklessness, poverty, they won't get solved without a stable and growing local economy. And that requires all the tiers of the supply chain to move as a super tanker, I think, would be my view.
Neil, what's your view on the, sort of tier one versus multiple tiers of the supply chain? I know my procurement history goes back to a long time ago when we were trying to build Terminal 5 at Heathrow Airport. And certainly my philosophy at the time was, I want to work with a smaller number of tier ones, but I want my tier ones to engage with businesses around the community. And that's actually where I got started on social economic sustainability back in the mid-90s. Neil, what's your view?
Yeah, to come back, you're absolutely right. The NHS is one of the world's largest employers. I think it's about 6. I think it's about almost the same as Amazon thing on the last figures. So we are talking about it. It is a massive organisation. I think these two ways of looking at this, and I think we sometimes get a bit hung up on sort of SMEs, and sometimes it is easier to work with a bigger supplier, a bigger tier 1 supplier, and encourage them in doing more work with after their supply chain. I also think the NHS is somewhat different than local authorities, because it's often people look at the share of local spend in a local authority with the NHS and say, well, why is it so different? So the NHS in the UK is strongly encouraged to buy via NHS supply chain, which is an organisation in its own right. And they tend to put in place very big national contracts with international firms, which makes it then quite difficult sometimes for NHS organisations on the ground to really sort of extract social value from their expenditure. The work we've been trying to do in the Northwest is try to be realistic. what type of suppliers we can easily work with. We know NHS supply chain and some of the big framework organisations are doing their own work at the moment, looking at social value in their frameworks, and that will start to filter through and make a difference. But I think there's an opportunity, especially for NHS organisations, to really focus down on certain categories of spend. So I think estates, as FM, are some sort of easier areas where actually we can start to work with organisations as a first tier supplier. It may be we need to change the way we go out on contracts. So, instead of us going out and putting a contract out, for the entire region, we need to split it up into lots and, work with suppliers to encourage them to bid for certain lots. So I think there's a bit of work we need to do as a buyer to think about, how can we make this easier for the suppliers Jill and others are working with? How can we split it up, get it into chunks and make it easier? The pushback is it'll be extra effort for the buyers because you might be dealing with 5 or 6 suppliers as opposed to one, additional effort, not just in the tendering process, but then in the contract management. So I think there's probably a bit more work we need to do to show the benefits of some of this. How do we show that this work is making a difference? And we're starting to see some of that done. And I know there's a few pilots underway at the moment in academia, to start to show, how many more people are we getting into work? How are we improving these economies? So I think it's a mix. I think we can do more to get smaller and first sector organisations into that third tier place. But I think with the work we can do with social value as well is now mandated across the NHS. There's more we can do, I think, with our bigger first tier suppliers to encourage them to look at their own supply chains and what they are doing as well. And that's going to, I think, also have a big difference as well.
Yeah, thanks, Neil. It's the constant dilemma, isn't it, that all large organisations face? How much procurement do you centralise, and how much procurement do you actually allow the judgments to be made locally? And in my 30 odd years in procurement, I don't think anybody's come up to the answer to that one. So it's a continuous dilemma that we try to face. Neil, you touched on the idea of measuring outcomes. Because at the end of the day, it's all very well, and I kind of find we get a bit, particularly in the public sector, a bit obsessed with SMEs. And is it a great idea to be working with hundreds of SMEs? And does that really work? And are there ways of adding social value potentially with large organisations? How do you measure impacts? And as I'm sure all of us on the call know, this is quite a controversial subject in terms of monetising social value. Certainly, I'm a monetisation cynic because depending on which proxies you use, you can end up with very different answers. What are your views on how you really measure the outcomes?
I think my first comment would be we're doing it at the moment quite badly. I think that would be my first observation here, and I think the NHS especially can do some learning here from our colleagues in local authorities who have been doing this for a lot longer. Obviously, there are the TOMs, for those who are aware of the TOMs, the themes, outcomes and measures, and that does put some financial proxies onto some of the measurement, which is fine, and that does get the interest of politicians, etc. When you can start to talk in numbers, which I think at times is helpful. But I also think these stories are sometimes what makes this really real. I'm sure we'll have all heard some really good case studies and examples from organisations, especially those who work in the health and care sector, who have actually reinvested back and got people into work or helped with mental health issues. And and those are real lives and real stories and real people. I think it's a mix of the two. You've got to have, I think, some of the hard facts and evidence, especially when in the NHS at the moment, the financial constraints it's under. When we're asking for investment in this type of work, we need to show the benefits and almost have some form of business case that says, look, if we invest in these works and these programs, we think these are the benefits we can bring. And again, I just sort of talked about earlier, the NHS, some of this can take 5 or 10 years for the benefits really to be seen. And that's when it makes this agenda, really difficult. I think the other thing on this to say is we're at risk, I think, and I'm sure we'll have all seen examples of this, where social value is put in the tender, and it might be we're asking about the environmental plans of the organisations, how they're going to reduce the carbon footprint, and depending on what they're bidding for, they may talk about how they're changing their energy suppliers and changing their fleet, etc., etc. And that's all great. And then we may ask them about some of the economic and social aspects and how they may be looking to employ apprentices or people who have been in long-term unemployment, volunteering days and everything else. All good stuff, and we'll put it in the tender. We're seeing a lot in the NHS still. The weighting is still relatively low at 10%, but we're doing some work with one ICS at the moment to increase that to 20%, which is great, and that'll help him, help give this area more focus. But then what the suppliers offered may not find itself into the contract, and then may not find we've actually got any KPIs which we can actually measure these, the supplier against. And then even if we do get it in the contract and some KPIs, the contract management then may not be done as accurately and as intensively as we would like. So we're not always making sure that what was offered at the tender process does happen in reality. And I think there needs to be a bit of a shift, in the public sector. And I know it is happening in some areas, to put more focus on the contract management side of these contracts and making sure suppliers are doing what they said they would do. I wouldn't ever say I'd like to see any public sector organisation end up in court because of any tender processes. But I think at some stage it will happen, that someone actually had lost out on a contract because of the social value aspects and the weighting. And then maybe the supplier which has won may not have done everything they said they were going to do. That's probably going to put some of this work under more of a spotlight.
That's a really cracking point. And Neil, you and I have known each other for a long time, so we're definitely on the same page on this. Yeah, I think it's sustainable procurement is much more than putting some evaluation criteria in the tender. And yes, I mean, attaching bigger weighting factors to the tender evaluation is a good thing, provided those requirements end up in the contracts and provided that performance is actually measured. Otherwise, the whole thing just becomes a waste of time.
Yeah.
The suppliers are very good at putting flowery statements, copying and pasting from the last tender that they won and putting some lovely statements into a tender that will enable them to win the bid.
And I think that goes back to some of our sort of earlier points as well. Well, the feedback we're getting is, the bigger organisations will have very good resources and teams who reply to tenders. They'll have a team and that's their job. This is what they do every single day. What we tend to find with some of the smaller organisations, especially in the sort of sector not-for-profit, is they'll say, well, social value is what we do. We don't have shareholders, we don't make a profit. Everything that we do, we invest back. So they're saying sometimes it's quite difficult for them to sort of answer some of these questions because they say, well, this is in our DNA. And that's quite interesting, I think as well. So we just need to bear that in mind when we're asking the questions and we're doing the evaluation.
Yeah, I think we do. And also, as you say, there are examples of larger organisations that employ consultants to prepare their responses for them. I've certainly seen that in my experience. And then the team that are actually delivering the job turn up and don't even know anything about what was put into the tender. Jill, you've been very quiet for a while. Neil talked about stories. And I'm inclined to agree that, that this sort of trying to evaluate social value using maths and pound notes sometimes doesn't work very well. And there is the TOMS. Other ways of monetizing social value are available. All commercial tools. There's no official government way of doing this. There tends to be then a competition to see what you can do to get the most points in TOMS, rather than what you can do to establish real social value. Do you have examples of stories that you're aware of or been involved in, things that you've done?
I mean, I agree with everything that's just been said, and I'm also in the camp of, making the measures overtly fiscal, although it is a very popular way of measuring social outputs, it sort of takes the emphasis off what social is all about and what environmental is all about. And as Neil said, those stories are really important. We were letting our travel management company procurement framework in an organisation I used to work for. And what we were trying to think about was how hard could it work? Now, I use the Sustainable Development Goals as a procurement practitioner to map to in terms of what does no poverty look like for my organisation and the local areas in which I serve, et cetera, right the way through the 17 goals. And actually what we got to thinking about in that organisation was what the travel management company is there to do and what we can embed in it. So we looked at commercialising, so hotels within a certain radius of train stations, city centres, that kind of thing, where you would have proven high levels of homelessness or rough sleeping, whether or not hotels could offer some sort of accommodation if it was available within that radius, and how they could signpost and work with local providers to offer, through a contracted way, offer accommodation for people to sleep or some place of safety, something like that. In higher education, we commercialised our employability agenda. So we asked our 26,000 students what value looks like to you, and actually, employment opportunities, placement opportunities were right up there with the things that were important. And every taught curriculum topic, we also bought their services. So we taught architecture, for example, and we also bought architectural services, but we hadn't connected the two. So our architectural design companies weren't offering placements to our student body. And it's really simple, some of those things, to connect the dots. Some are much more complex, as in what you do with hoteliers on homelessness. That's really quite complex and difficult to do, not impossible, but it's more complicated. Whereas actually asking your supply chain for what they can do from an employability perspective is a bit simpler, and it can be as much as a guest lecture, a work placement. It doesn't have to be a grad scheme. It doesn't have to be a financial drain on an organisation. I'm a director of a multi-academy trust, predominantly special educational needs children. And so employability is a huge agenda, and it's hard for mainstream schools to find employability opportunities. For children with additional needs, it's exponentially harder. So trying to connect the workforce with the future generation, I think, is, there's so many stories of employment that, as Neil said, we want communities to be healthy, to be in good paid employment, so that actually they need the NHS less, they need social care less in later life. And you've got so many opportunities through procurement to do that creatively. The Sustainable Development Goals, for me, are a great tool to use to think about the lenses of social and environmental impact that you can have. I would say, just to finish off, that Neil said about make sure you get the contract that you intended to get. Greenwashing, for example, is rife. You do have organisations, almost the two extremes, organisations with really experienced bid writers who know how to write a bid, they know how to win a bid, but don't necessarily know how to deliver the contract that they wrote. And then you have organisations who know how to deliver social benefit, but don't know how to represent that well in a bid situation. And both of those things are at play.
Yeah, thank you. Well, there's lots of things to unpack there, but the whole thing about employment and employment prospects is really key, isn't it? I mean, I remember working not that long ago with a very large contractor to the public sector, and they run prisons. And well, what are you doing in your procurement about employment of ex-offenders? And the answer at the time was not very much, and that's improved since then. Because that's kind of an obvious thing to do, isn't it? If you run prisons, you would like to try and find ways of employing ex-offenders. So there are some obvious things and some things that are a lot more tricky to deliver. And yes, I mean, thank you for the advice around the UN Sustainable Development Goals, because that's a very good place to start. I mean, you read them at first and think, that ending world hunger and poverty is a lofty ambition, but actually, if you look at it through the lens of what can I do in this procurement to contribute towards that objective, and of course, not every objective is relevant in each procurement. I think the other point that I really liked you coming up with is, when you talk about higher education and engaging with your stakeholder body, which is the students, which will mean that sustainability is a contextual thing. It's different for different organisations in different geographies. It's not always the same. Can I ask both of you a question about ISO 2400? I guess I sort of need to, because we're ISO2400.org. The Dutch public sector are starting to mandate the standard to their public sector procurement bodies. Where are you on the standard? Is it something that you use? Is it something that we should be using more in the healthcare and the public sector?
I mean, I can go first on that. So I think the NHS has gone down a slightly different route here, and it'll be interesting to see how this developed. There's something called Evergreen, which is what NHS England and NHS Supply Chain are asking now organisations to complete, which is almost a self-certification around where they are regarding various environmental and sustainability goals. It goes a lot further than you might think. It looks at real living wage alongside lots of other indicators, as you'd expect, so the carbon. That's just starting to be embedded, and it's becoming mandatory, as I say, for parts of the NHS. So it's going to be really interesting to see how suppliers take to that, how it moves this agenda forward, what it tells us as a buyer. I think in the early days, it won't form part of the evaluation. It's more there as an inform. And what the NHS is also now doing is asking all suppliers to give evidence that they have carbon reduction plans, that they're in place, they have targets, those targets are approved by their board and they're published. I think that's where the NHS is at the moment, which is probably not quite going as far as some of the standards. But I think it'll be, from the feedback we're having, it has got people talking about this agenda. It's probably given an indication to the market that this agenda is serious. It's not going to go away, and they need to support, the NHS in its ambitions in being a net zero healthcare organisation.
Jill, anything to add to that?
Yeah, I mean, I'm a fan of the standard. I know the standard quite well. I've been in and around the standard for years. I think the key point for me is consistency. So actually, if the public sector as a broad-based organisation all chose that ISO 2400 is the standard that we will work to, and the expectation is that our marketplace will adopt the principles of 2400, then actually that would be useful. In some cases, it sort of matters less what the what is, but that everybody asks for it, because what's difficult is if NHS adopted 2400, for example, local government did something else, Blue Light did something else, then it becomes quite problematic because you don't have that consistency. So I don't know what the direction of travel is. I don't know how to influence it either, but that consistency message for me is really key. So whatever we do, if we can all do it, then actually we might have half a chance at developing the marketplace and the buyer community to move like a supertanker.
No, thank you for that. I think, yes, I read an article on LinkedIn, a very long article about public procurement and sustainability, and it concluded that, the public sector needs to really kind of institutionalise and bake in sustainable procurement practice. And the whole article, didn't mention ISO 2400 once. It's like, yeah, there is a standard. It's already there. Why don't we use it? Now, of course, I'm very passionate about this because I spent 4 years of my bloody life developing the standard. But nonetheless, I think it's something that's, interesting to observe as we go forward. And some of the things that Neil described are things that are in the standard anyway. It's you're kind of doing it, but it's turning it into a more strategic and embedded approach, I guess.
The key word for me is that embedding. So, sustainable procurement isn't an add-on. It's not a project. It's not something that we think about after we've thought about everything else. It's not an afterthought. It's plan A and there isn't a plan B. We should be thinking sustainably at every point of the procurement cycle. And so the standard, it being embedded in all of that thinking, would be super useful, because we still today, procurement is a finance-led function still. And so still and nobody should apologise for worrying about the money, of course, but actually we are still the priority would be cost first, impact second. And until they become at least equitable, it will be difficult to get some real transformation, I think.
Sometimes it's what is the best level at doing some of this, and you've got, the NHS, as we've already talked about, a massive organisation, but is actually hundreds of smaller organisations as well. So you've got that dynamic, and sort of some NHS organisations doing their own thing. You've got the integrated care systems now working at the system level. So working with, for example, in Greater Manchester with the Combined Authority and the 10 councils, and different councils have different ways of doing things. The GMCA has a slightly different way of doing things. Some NHS organisations have a slightly different way of doing things. We don't want to make this any more complicated than it already is for our suppliers and those who are bidding. But it's often quite difficult to work out what level some of this should be agreed, what the standards are. For example, in Greater Manchester, they've got a really good initiative, the Good Employment Charter. So it's encouraging suppliers to sign up to the Good Employment Charter, which is great if you are a supplier who operates and is based in Greater Manchester, but may not be as attractive if you're sort of, to Lancashire, for example. But the things in that standard will be relevant for any organisation in doing the right things. So I think, as Sean has already hinted at, if only there was one international standard that we would all follow.
If only that were to exist. Okay, I'm conscious we've been talking for a while, and I know that Jill is a little bit time constrained, but there's a couple of other topics I'd like to cover if I can. Services, and without getting into any sort of controversial things about privatising NHS services or whatever, it is clear that some clinical services now are provided by contractors. I mean, I went for an MRI scan recently, and I went off into this little caravan thing that was obviously a company that were providing the MRI scan, and it was fine. It all works very well. Is that something that's within the thinking in procurement? I'm thinking about kind of things like outsourced services, because we know they happen, and politically, whether there's an argument for or against it, I don't want to get into that. But how do we integrate sustainability thinking if there is outsourcing of some of the services that the NHS provide?
It's very simple terms. I don't think it makes a difference, or it shouldn't make a difference. So I think even when services are outsourced, we bring in third parties, private sector organisations. There is still a contract. There will still be a process which is followed to appoint a supplier. Obviously, some big changes in the regulations that came into place in the healthcare sector on the 1st of January, which does change some of that process. But the Social Value Act still applies. So actually, we should be thinking of social value in any contract we are letting, regardless on what services it's for. And it might give us interesting opportunities in working with these firms on what else they can do. So I sort of see it really as an opportunity as opposed to a risk.
Yeah, I think it's, but again, it's that key message that, as you said earlier, Neil, get it in the contract. And if it's in the contract, and if that contract is managed in a way that the supplier or whoever actually delivers what was expected of them in the first place, then that's very key. I'm conscious also that we've been talking for 50 minutes now, and we've hardly mentioned carbon. We've talked a lot about social value. So, Neil, Jill, what's happening? You've talked about, NHS's Scope 3 footprint must be the most complicated thing on earth, I should think. How are you dealing with carbon in the supply chain?
So, I mean, the NHS was the first healthcare system in the world to say it was going to become net zero, and has done loads of work. So every NHS trust, every integrated care system has got a green plan, which says how it is going to achieve being a net zero healthcare system. Probably fair to say that most of the focus has been on Scope 1 and Scope 2, but Scope 3 is about 64%, I think, of the NHS carbon footprint. So actually, our supply chain has a massive part to play. And some of the things I talked about earlier, like Evergreen and carbon reduction plans, are going to help, sort of get our suppliers in in a better place. But I think, again, there's some really sort of interesting work we can do, and we're seeing lots of work around looking at moving from single use to reusable, looking at reducing waste, looking at using products less. So gloves, for example, is a key one that often gets talked about. Is mostly made in the Far East, has been historical issues with modern slavery, big carbon footprint because it's shipped over. Use of gloves during COVID went through the roof, as you can imagine. So actually now, there's some really interesting work going on about education. When do you really need to use gloves? Do you need to use them in all circumstances? Sometimes you don't. And we all know the most sustainable way of working is not using a product at all in the first place. So, there's lots of work going on there. Lots of really good work on fleet as well. Here's a stat for you, Sean. I know you like your stats. NHS has the biggest fleet in the UK after the post office. So our remit is huge. Lots of good work going on, but obviously lots more that we can do and also need to do over the next 10 years or so.
Brilliant, thanks, Neil. Jill, any thoughts to add on carbon?
Yeah, so and actually, where the company I lead, we offer a free action planning tool for suppliers. Because what we find is, and actually I was just listening to Neil over the last couple of minutes, and what you talked about was carbon reduction, waste reduction. We talked about social impact, cost impact, and all of that gets chucked to the market to deliver. It all gets passed through. And so there's a layering effect there. And where larger organisations, and especially contracts over 5 million, your carbon plan has to be in place by law anyway. Those smaller organisations in lower tiers or who are smaller but in tier 1, lots of providers just don't know where to start with some of this stuff. It feels in the too difficult space. And so there is a bit of is it an emu or an ostrich that puts their head in the ground? I can never remember which one it is. One of those. Whichever one it is, there's a bit of that effect going on. I'll sort of not look at it until I absolutely have to. But it's becoming a differentiator. There is no plan B, or planet B, as people say. We do have to think about the carbon footprint that we create and how to reduce it. So we spend a lot of time working with organisations on what are the actions that you can take as a Scope 3 supplier as an enabler then to organisations like the NHS who have got their green plans. How do you become an enabler to that? And how will that help you find and secure work going forward, in your public sector growth plans as is? So there's lots going on, but 2030, 2040, 2050, they feel like a long time away, but they'll be here before we know it. So we can't ignore it in the supply chain forever. We have to start doing things about it now. And it's hard getting suppliers to think about it. Really hard, because we're also wanting them to think about absolutely everything else as well, aren't we, at the same time?
Brilliant, thank you. Yeah, it's hard. I think that's a good message to close on. Very conscious of time, so I think we probably need to close now. I'd like to thank both of you for joining. I think this is going to be a fascinating podcast for our audience, and there's loads of other things that I'd like to cover as well. So I'd like to maybe bring you back one day. I'm particularly interested, one subject we haven't covered at all is supporting and upskilling the supply chain, particularly small businesses, and how we do that. But we really don't have time to talk about that today. So thanks very much to both of you, and do enjoy the rest of your day. And we'll hopefully engage you again in conversation very soon. Thank you.
Thank you for listening to our podcast on Sense and Sustainability. Please listen out for more episodes. For more information, learning resources, tools, and much more content on sustainable procurement, go to www.iso2400.org.